Hi, I'm Jeanne Sarnosky, and I'll be your host today for another installment of OneCape Health News, a health information TV program brought to you by Cape Cod Healthcare. This program has been developed to bring you health information you can really put to use in your daily quest to stay happy and healthy. We go behind the scenes at Cape Cod Hospital, Falmouth Hospital, urgent care centers, the homes of a few of our VNA home health patients, and the offices of some of the most respected and qualified medical specialists in New England. We'll take you wherever we need to go to give you exclusive access to find answers to some of the most asked healthcare questions that arise every day. Now, on to our first topic, one that is near and dear to my heart, the Visiting Nurse Association of Cape Cod. This year, we are celebrating our 100th year as an agency. Yes, the Visiting Nurse Association of Cape Cod has been in existence since 1916, one of the oldest nonprofits on the Cape. Think about that for a second. That was the year the National Park Service was created, the first PGA Championship was held, Pancho Villa invaded New Mexico, the very first Rose Bowl game was played, and World War I was well underway in Europe. The world was changing. And much has changed over the years at the VNA since that time as well. We grew to include the Mid-Cape, Outer Cape, Lower Cape, Upper Cape, and today we cover a geographic area of over 1,200 square miles, from Plymouth to Provincetown, as well as the islands of Martha's Vineyard and Nantucket. I'd like to introduce you to the President and CEO of the Visiting Nurse Association of Cape Cod, Diane Kolb.
100 years ago, the Woods Hole Women's Club made the recommendation to establish a nursing agency for Falmouth and the residents to meet their healthcare needs. And what started as one nurse on a bicycle, it's developed over the years into the VNA of Cape Cod. What we're seeing today is a lot of changes with the way we're being reimbursed, which changes. It's called value-based purchasing, and the quality of the care that we're providing is really being measured as it is in the institutional settings, as in hospitals. Most patients, regardless of how sick they are, would prefer being at home. They want to be with their family, they want to be in their own environment, they tend to heal quicker, they tend to be more compliant than in a hospital setting. And as they're discharged sooner, we're able to meet those needs in the home by providing that level of care that years ago they would have received in a hospital or in a skilled nursing facility.
I spoke with a few of our very experienced nurses about their earliest memories of how the VNA has changed over the past 30 years.
Okay, well, when I started at the VNA, I was with the VNA of Central Cape Cod. We had covered 5 towns.
Well, at that point, we were the VNA of Upper Cape Cod, so this is prior to a merger of 3 agencies, and we were 9 nurses for the entire Upper Cape Cod. We had 1 nurse on the weekend, and we were on a paper record, a paper medical record.
In 1998, the Visiting Nurse Association joined Cape Cod Healthcare and combined all of their previous VNA offices into one. At that time, they began investing in the future with technology. The VNA has continuously kept up with technology in their quest to provide the best possible outcomes for patients at home.
Technology-wise, the advances have been tremendous, and the phones and the ability to take photographs of the wounds and then email them to physicians has helped with the communication tremendously. And amongst other nurses, instead of a nurse waiting for us to try to get to see a patient, they can email us a photo and we can do a lot of education right there over the phone.
The laptop computer certainly saves us mileage, so we're not circling back to the office to deliver a paper chart, so that's huge. I think care is improved because we can really expedite things more quickly. We can recognize certain trends more quickly because of the telemonitor. The telemonitor is ideal for certain patients that have issues with their weight. It's part of their disease process that they might gain weight, and gaining weight is very insidious. It can kind of creep up on them. So by having sort of a structure to get on the scale, and then they can do the vital signs with the monitor, all that information gets transmitted, and the fact that it's a sort of daily routine and it's transmitted so that we can see it and through our laptop, doctors' offices can see it. It gives the trend and not just one day's worth of data. So for some of our patients who are just barely staying out of the hospital, it's been very key.
They've been a tremendous lifesaver.
And they were phenomenal. I can't say enough for the VNA.
They've enabled us to keep going here at our home.
And they taught me so much of what I needed to do as a patient to recover from such a major surgery in my home.
It was so very important for Christopher to be home with us and to have the VNA hospice available to us, to advise us, to take care of us as well as Christopher, to keep him in a family atmosphere, was the answer to a mother's prayers.
The VNA was marvelous right from the word go. It was just, I could not have done this alone. There's no way I could have done it alone for the length of time that they were able to help me. It was just a marvelous relationship.
As you can see, we've grown a lot over the last 100 years, and we look forward to the next 100 years as well. Next, we will be taking you to the Women's Breast Health Program at Cape Cod Hospital and the Wilkins Outpatient Medical Complex in Hyannis. We'll learn about some exciting new procedures to detect breast cancer and a very new hidden scar breast surgery technique to minimize the disfigurement of breast cancer surgery.
I'm standing at the harbor in Plymouth, the landing place of the Mayflower and the Pilgrims. Not far from here is a satellite location for the VNA of Cape Cod. The VNA of Cape Cod cares for patients in 25 towns from Plymouth to Provincetown and the islands. In Plymouth alone, we watch over 300 patients on any given day. It takes more than 750 employees to cover over 1,200 square miles.
I think it's important for patients on Cape Cod to know that they have access to excellent cardiovascular care in 2 hospitals.
We have very good relationships with all the cardiologists in the community, and that's one of the advantages of being in this environment is we have that kind of collaborative arrangement.
We bring to the table a variety of different experiences and knowledge, but we've been able to work together to, I think, optimize what we're able to do for patients.
This group has been very constant and stable over 3 decades, and as a result, we're immersed in the local community.
So you feel that you can genuinely speak to these people and say, you're going to get a good operation here.
It's all about patient care in the end, and the patients are really much better off for having all these services on the Cape.
The Heart and Vascular Institute at Cape Cod Healthcare. Expert physicians, quality hospitals, superior care.
OneCape Health News, Cape Cod's go-to source for timely, informative, and credible health news, advice, and tips. It's news you can use and understand. Direct to your inbox. Healthcare can be complicated, from modifying your diet to understanding the latest cancer treatments to aging well. There's a lot of information out there, some of it contradictory. OneCape Health News is published by Cape Cod Healthcare and is written and produced on Cape Cod. Our goal is to provide you with leading expert advice from local doctors, providers, and other experts. Sign up is easy. Just add your email address and each week we'll serve up our best, most engaging stories, videos, and pictures delivered right to your email inbox. You're just one click away from valuable health news and features without ever leaving your computer, your tablet, or your phone. Sign up today at onecapehealthnews.com.
I'm here in Provincetown, the very tip of Cape Cod, in the shadow of the Pilgrim Monument. President Theodore Roosevelt laid the cornerstone of the monument in 1907. Just a few years later, the VNA of Cape Cod began its mission of providing health care at home to all residents of Cape Cod. Even out here at the end of the Cape, when you receive a home care visit or even your annual flu shot, chances are it's a VNA nurse, might even be me.
Welcome back. Early detection of breast cancer is often the best defense against this disease. Statistics and local readings of diagnostic breast studies by the Cape Cod Healthcare radiologists show there is a high risk of breast cancer on the Cape. The Wave of the Future in Breast Cancer Screening is now available on Cape Cod. A FAST MRI, which is a shorter version of the diagnostic breast MRI, will be a new tool in the screening process for women who wish to have an additional level of testing between their annual mammograms. The screening is now available at the Cuda Women's Health Center in Hyannis. FAST MRI is especially important for Cape women.
FAST MRI is really a shortened version, an abbreviated version of a diagnostic breast MR that we've been doing for years. It's really taking the essential parts of a diagnostic MR and making a 40-minute study into a 3 to 5 minute study, and still having all the necessary information to diagnose aggressive and small breast cancers without losing any information, and still high resolution. Mammography in general, unfortunately, is able to detect some breast cancers, but it has a sensitivity of only 40%. And it's particularly, sensitivity is even lower for women with denser breasts, so it's missing more of those cancers. So we've been doing diagnostic breast MRI for years, and with great results, and we know that certain parts of the MRI are all we need to detect cancers in the majority of patients. And I was waiting for some European studies to conclude that showed that, for example, that for 1,000 patients screened, this fast scan breast MR found 18 additional cancers on top of the ones that were found by mammography. So it's a life-saving tool to diagnose cancers earlier. And so we felt that as soon as we were able to provide the service, even though insurance is not currently covering it in most cases, that we wanted to offer to our patients on Cape Cod.
So genetic testing is something we offer here, and what we do is we look at family history of breast cancer, but not just breast cancer, other cancers as well. And for women who might qualify for testing, they meet with one of our breast surgeons and they can have the test. If that test comes back positive, they have a consultation, and there are different options for women depending on what that genetic test shows. There's multiple different genetic mutations which all carry different risks. But one of the things that we do offer to women with increased risk based on family history, as well as those who have a positive genetic mutation, is MRI, because MRI is incredibly sensitive for picking up breast cancer. So on top of a yearly screening mammogram, these women will have a yearly screening MRI. And the combination of the two is very sensitive to picking up breast cancer as early as possible.
Women who are considering a fast breast MRI can discuss this option with their primary care physician, who can then refer them to the Cuda Women's Health Center to make an appointment. For women facing the trauma of breast cancer, a surgical scar is often the last thing on their mind, but afterwards it can be a permanent reminder of their illness. Dr. Catherine Dalton, a breast surgeon at Cape Cod Hospital, felt the disease was upsetting enough without the added worry of having a visible scar. For the past 3 years, she's been perfecting ways to perform lumpectomies and mastectomies with as little disturbance to the outer breast as possible. Her technique now includes hiding the scar under the fold of the breast or under the arm, using the natural contours of a woman's body to conceal it.
Patient's number one concern is removing the cancer. Their second concern is, how am I going to look once this cancer is removed? And nowadays things are moving towards more minimally invasive approach, and fewer incisions, not such a big scar. And the cosmetic part of breast cancer surgery is really evolving, and we're able to remove pretty large tumors and save the person's breasts and get them to look pretty pleasing. I don't make any incisions on the breast whatsoever. I make incisions on a natural crease or a natural part of the anatomy, which will hide the incision once it heals. It just looks like it's a part of a skin fold or a natural curve to the body. And it removes the tumor. And I also put the surrounding tissue back to close where the tumor was, so there's no evidence that something was even there or anything was done before.
When we return, we'll be discussing the latest techniques in neurosurgery.
I'm standing at the Whaling Museum on the island of Nantucket, the go-to museum for island history in an 1846 candle factory. Did you know the VNA of Cape Cod has been the provider of home health care and hospice services for patients on the islands of Nantucket and Martha's Vineyard since 2014? With a satellite office on each island, VNA nurses, therapists, home health aides, and staff are currently keeping watch over more than 300 patients on any given day, ensuring that they are safe and healthy at home.
Vascular diseases and vascular surgery now requires really a multidisciplinary approach.
The team approach at the Heart and Vascular Institute allows us to work together for each and every patient.
The surgeons and the cardiologists and the interventional radiologists and vascular surgeons will all work together on one patient to collaborate, find out what's the best procedure for them.
The nice thing about a system like we have here at Cape Cod is that the patients are always under the direct care of the senior attending physicians.
It's not that we're just doing procedures here. We're really trying to take care of the entire patient. So in helping them improve their lifestyle going forward.
We are positioning ourselves in a way that will best serve the community, our community.
The Heart and Vascular Institute at Cape Cod Healthcare. Expert physicians, quality hospitals, superior care.
You come in early morning, 8 o'clock, and you just hope that by 8 o'clock the next morning that you're going home.
Neurosurgery of all the fields I feel is still very much an art. There's a lot of science behind it, but not every disease, not every patient's going to get the same treatment.
We had the first call, taking a patient out of a house, carrying him down a hallway, twisted. The pain was immense all through my arm. Knew something was wrong.
Ben and I had a very good communication because I knew what he expected of me. He has very high demands on his body, and he's often in difficult situations.
He knew what kind of line of work I did. He knew what was expected of me post-surgery.
We have the latitude to do what we need to do with the newest technologies. Being a healthy, motivated guy, he was a perfect fit for the procedure.
I woke up from surgery, and the first thing I did was move my right arm, and there was no pain, and it felt wonderful.
We love our people here, but our love of the science is how we help them.
If I'm back at work, they've done something right.
Advanced neurosurgery, here at Cape Cod Healthcare.
I'm standing here on the green in the Dentist Village, not far from the VNA of Cape Cod's Hospice Program Office. VNA Hospice has been providing symptom management and end-of-life care to the people of Cape Cod for more than 100 years. Offering compassionate care and support, the hospice team can provide services wherever you are, at home, independent living, assisted living, nursing home or hospital, enhancing your quality of life.
Transforaminal endoscopic discectomy is quite a mouthful, but the new procedure is music to the ears of patients suffering from a herniated disc. Hyannis neurosurgeon Paul Houle of Cape Cod Healthcare Neurosurgery was the first to perform the minimally invasive surgery in Massachusetts. Dr. Houle performed the surgery at Cape Cod Hospital for the first time last summer and has since done the procedure almost 50 times.
I've always had dogs. I love animals.
Betty came to me because she had searing leg pain. It just wouldn't go away.
I was very concerned that I was really going to have to change my whole life. Everything I do requires a lot of physical work. Dr. Houle thought that he could make me better, and I said, well, what I really want to be able to do is to run my dogs.
After much discussion with her, she opted to go the surgical route. We are doing a new procedure called an endoscopic discectomy, or an ultra minimally invasive discectomy. It's an exciting new way of looking at an old problem.
We never appreciate good health until we don't have it. Now I'm back and doing what I like to do.
I find that very personally gratifying. Someone doesn't have to change their life. They can go on with their life and be able to do the things that they love to do. And that's why I'm here.
Traditional methods of discectomy have a success rate of 75 to 85%, while studies have shown a success rate of over 93% for the new endoscopic technique.
Cape Cod Healthcare has been incredibly supportive of our mission, of our professional goals. I mean, what do you need to deliver, good neurosurgical care, excellent neurosurgical care?
We have a full range of physicians here that offer very high technical ability.
So we have excellent facility, we have excellent surgeons,
We have all the technology that we need to do the job that we need to do.
But we leverage technology to make our practice work for both us and for our patients.
The leadership here has made it very easy for us to try all the new things and figure out which of those make the most sense for people.
We are doing a new procedure called an endoscopic discectomy, or an ultra minimally invasive discectomy.
Things that would require a big operation, 10, 15 years ago, now much smaller operations.
We have a machine called an O-arm. There's only 4 in Massachusetts, and we have one of them. We've done over 600 surgeries with this O-arm, which is basically an intraoperative CAT scan that allows us to place screws in a very accurate manner that improves the quality of the surgery and the safety of the surgery for the patient.
We have all the technology that we need to do surgery or to treat patients non-operatively for that matter.
And there are very well-established treatments that are absolutely foundations upon neurosurgical training and what we do as neurosurgeons.
We have the latitude to do what we need to do with the newest technologies and deliver it in the way that's most appropriate for the people.
Fascinating. When we return from the break, we'll be learning about the orthopedic surgery program at Cape Cod Healthcare.
I'm standing at the Knobska Light in Woods Hole on the southwestern tip of Cape Cod. 100 years ago in Woods Hole, the Women's Club recognized a need for town nursing service, and the VNA came to life. In July of 1916, the first nurse began her duties, traveling by bicycle to care for patients in their home.
The OneCape Health News app is good health on the go. Go to your app store and search OneCape Health to download. Featuring engaging stories written by a team of experienced journalists. OneCape Health News is the go-to source for timely, credible, and informative health news. One touch and you can read news by our expert physicians and find the health topics that interest you most. Like a story? Share it. Found a story you just love? Favorite it. Whether on your smartphone or a tablet, the app is the best place for you to engage with all things OneCape Health News. Find a physician? Search our Cape Cod Healthcare locations. Click to call or get directions to your doctor's office anytime with just one click. The OneCape Health News app puts your health in the palm of your hand. Download it today.
A lot of the diagnoses that we give in neurosurgery are really life-changing.
I couldn't move my arms away from my body more than maybe 1.5 feet.
Something is grossly wrong, but what is it?
His degenerative changes in his spine were so advanced, he had compression of his spinal cord. It affected his motor function.
He knew right away what was causing my pain, but he makes sure that before we left that office that we understood fully what was going on, what was wrong with me, and what he thought he could do.
I need to educate the patient and make them understand this is what your problem is. This is your diagnosis. These are your options.
You have to have that surgery. At least to have another go at life, because your quality of life won't exist.
Collaboration starts the day they walk into the office.
If you're going in for something like I went in for, a life or death thing, you want to make sure that you get the best care, and that's what we got. Dr. Coper was the best care.
Advanced neurosurgery, here at Cape Cod Healthcare.
I'm here in Sandwich Village, the home of the Dexter Grist Mill, one of the oldest watermill sites in the United States. Sandwich is also home of Tradewinds Adult Day Health Center, one of 2 centers offered by the VNA of Cape Cod. The other center is located in Howard. This alternative to nursing home placement provides a warm, friendly place for seniors to participate in fun and stimulating activities while offering much-needed respite for the caregivers.
Welcome back. Patients choose Cape Cod Healthcare for joint replacement surgery because of its reputation for top-notch orthopedic physicians, convenience to home, and of course, the private rooms. Walking away with a positive and lasting impression of the experience, however, can be attributed to the nurses and other healthcare providers responsible for their care.
We decided as a corporation to put together a total joint program so that we could serve the members of our community by providing quality health care and quality total joint replacements to our patients on the Cape, so that there was no need to travel off Cape to receive these services. So we really put together a comprehensive team of nurses, physicians, anesthesiologists, surgeons, physical therapists, occupational therapists, outpatient rehab as well, to provide a continuum of care for these patients from surgery to post-op recovery.
The nurses on staff at Cape Cod Healthcare's Total Joint Center, which operates at both Cape Cod Hospital and Falmouth Hospital, are dedicated to the needs of their patients and are available around the clock to guide the recovery process.
We offer many services so that the patients are prepared for surgery. We offer a pre-op education class.
Your doctor's office will schedule your PAT appointment. It'll last about 1 to 2 hours.
It's offered multiple times each month on Tuesday afternoons for about an hour and a half. Patients will come in to the LaRusso conference room. We go into detail about what they can expect here after surgery and what they can expect when they go home from the hospital.
Our outcomes are better and our infection rates are lower, and we're very proud of that, and to be able to keep you close to home where your family can really get accessible visitation to you and really stay in your community for rehab as well, and seek outpatient rehab in our establishments as well. It's a special thing to be able to do that here in the community.
Former patients who have gone through the program often approach the nurses in the community to say thank you and ask for a hug.
I had a right total knee replacement on February 22nd of this year. Being a registered nurse, working my whole career in the Cape Cod Healthcare system and having to utilize it for this surgery, and having, JML available to help me with therapy right after surgery, and then coming home and being totally lost and being saved and by the VNA and getting me to where I am today. I just feel that what they've done for me, being in the system, was just, there's no words. All I have is emotion, and it's real emotion, and I thank them all.
Some patients even go so far as to lift a pant leg to show their new joints or jump up and down to reveal how well they have progressed. One of these patients, Vernon Ellers, underwent a total hip replacement procedure earlier this year.
I can sum it up in one word: caring. They are extremely good, and that goes, they are interested. They listen. That's one thing that you don't see too much. They come in and they listen and they take corrective action in doing that. And I felt very good, and that went not only from the doctor to the nurses, to the nurse's aide, but even to the cleaning people. They always had a smile. How are you this morning? It does make a difference. I tell you, laying in that bed and looking out a nice window, and that 6th floor is beautiful where it looks out, and you have it, and it really, I can't say enough accolades about it.
Well, that's all we have time for in today's show. I'm Jeanne Sarnosky, wishing you good health and good health care.